Thank you for coming tonight. We're going to wait a few minutes before we start. I know people are still logging in, so just give us a couple minutes and we'll get started. I'm so glad you could come. And everyone, if you want to start, if you want to put your information in the chat box, if you want to say your name, where you're from, if you know you have questions already, start using that chat box. It's at the bottom of your screen, and just make sure that goes to everyone. Thank you. Started now. So my name is Kathy Nauta. I am joined tonight by my colleagues Lucy Pritzker, Fran Schlenoff, and Sharon Finley of Elm Street Placements. We are a therapeutic and educational consulting firm. We are happy to host our first webinar tonight, Redefining Successful Parenting, with Dr. Lisa Rosen, who is the Director of Parent Support at Mountain Valley Treatment Center. Mountain Valley is a short-term residential program for adolescents suffering from anxiety, OCD, and depression. Dr. Rosen is a clinical professional who has worked with adolescents for over 20 years. In addition to her duties at Mountain Valley, she is trained in supportive parenting for anxious childhood emotions and privately coaches parents of children diagnosed with anxiety and OCD. She is also a neuropsychological rehabilitation coach and a traumatic brain injury on-site coach. Before we begin, as I mentioned before, if you have any questions, please type them in the chat box at the bottom of the screen, and I will let Dr. Rosen know as we go throughout the presentation about the questions, and we will also have time at the end of the presentation. So I'm excited to introduce Dr. Rosen and Redefining Successful Parenting. Thank you so much.
Thanks, Kathy. So as I'm sort of peeking in the chat box, which is now going to disappear for me, I'm seeing a lot of you have very similar personal paths to my own. So as I start, the first thing I want to share is a personal story and the crooked path that my family has taken. My children are 22, 20, and 17. I have 3 kids, none of whose paths were traditional. If a traditional path looks like elementary school to middle school to high school to college to post-college. My son is a chef, so his non-traditional path is sort of fun. Although it was hard for us when he was young to sort of listen to his passion, and it took us until he was a sophomore in college and essentially failing out before we allowed him to pursue his own goals, and he could not be happier. I have 2 daughters, my 20-year-old and my 17-year-old, both suffer from mental health challenges. This used to be a pretty unique story as I shared my story. I've done many, many panel discussions, and clearly from the audience I'm looking at, my story is not unique at all. So what might be unique is that I do wear 2 hats. As Kathy said, I am both a parent of kids with mental illness and I am a clinical psychologist. So as they say, the cobbler's kids have no shoes. I raised 2 daughters who really, one of them when she was 12 and really with no symptoms before then, started to suffer from major depressive disorder. And my youngest daughter started with school refusal that we thought she was just trying to be like her sister, and liked all the attention her sister got for her severe depression that kept her out of school. And so we were very dismissive. And it took a lot of years to even pay any attention to my youngest, who ultimately at some point 2 years ago, during a crisis with my older daughter, said, "You need to send me away, I am not well." And she had been in and out of several schools. She had been homeschooled. She had been at Fusion Academy, which for those of you who don't know is a one-on-one school setting. She had been in a private school, in a smaller school setting, and she had gone back to public school very successfully. for 1 year in ninth grade. But when her sister crashed and burned before her freshman year of college, and had gotten an early decision to her top choice school and then could not go even to the orientation, we dropped her and stayed in a hotel, and 24 hours later, after she spent 24 hours in the mental health center there, we brought her home. So my youngest daughter at that time was about to enter into 10th grade and said, I'm not going to survive this and you need to send me away. And we had no knowledge of residential treatment programs, wilderness programs. It wasn't, was a language we didn't speak at the time. And she helped us find Mountain Valley Treatment Center. And she and I spoke to the team there, and she was there. We brought her up. She was there for 76 days, and then transitioned, did beautifully there, transitioned to a mainstream boarding school where she was until they shut down a month ago. My other daughter successfully got additional treatment, including transcranial magnetic stimulation, which is not part of this webinar, but has come up recently. So if anyone has questions about that, not that I'm an expert, but I do have a child who went through that. I can certainly talk about that privately with anyone who's interested. So that was our journey as parents. When my younger daughter was in the treatment program at Mountain Valley, she struggled quite a bit. I think she thought it was going to be a wonderful reset to her life and she would get to start over, and it's a beautiful setting. And I don't think she realized the hard work she was about to face. And so the exposure response prevention treatment that she received and the cognitive behavioral therapy she received was terrifying for her, even though she had been in years and years and years of therapy, as you can imagine. And she had a very difficult time, became severely depressed, became actively suicidal during her stay at Mountain Valley. And for Mountain Valley, that was a pretty familiar course. For us, my husband and myself, it was terrifying. And we didn't feel that there was enough support at the time. And I still think we have, we like to talk with I talk with all of my parents about parental post-traumatic stress disorder. We call it PPTSD. It's not my term that I coined. I heard it from someone else, but all of my parents can relate to it that I work with. And it was an awful journey for us. And so I approached Mountain Valley afterwards. We talked for quite a bit of time, and they were brave enough to hire me to be their director of parent support. And so I have since then created webinars such as this for parents, including psychoeducation about how to cope with raising kids with severe anxiety. Kaylee, my youngest, also has OCD. And and we do a whole bunch of series of webinars, and I also run support groups for parents at Mountain Valley. And then, as Kathy said, I work privately. So that's my journey. The benefit of my wearing two hats is that I have the wisdom of being in the shoes of a parent. And I also do have a clinical background, and I work with parents all the time. So in talking about how to cope with uncertainty and times of intense stress, as we are all sort of facing at the moment, the most important thing I like to say to parents at the outset is that one-size parenting never fits all. Clearly, I have 3 different children who have 3 very different coping styles. And this is never more true in times of uncertainty and stress. So if your kids are very different in the way they will express anxiety or stress, it's really important to pay attention to the fact that parenting them does not look the same. And the skills you will need with one of your children is not the same as the skills you will need with another. So take time to consider how each of your children manages their stress and copes with the challenges normally. And clearly, this is not normal for any of us. And so it is important to look at, are there differences in the way they're expressing their anxiety or coping now? Or are they sort of reaching back into their treasure chest of coping skills and using them or not using them, but showing signs of their anxiety and whatever other mental health challenges they have in a different way now. So sort of paying attention to that is very important. And then it's very important to pay attention to your own inner voice. Clearly, right now is a time where many, not all, many of us are feeling incredibly anxious. Being anxious would be normal now, of course. There are those. I have one of my daughters who thinks this is the greatest thing in the world. She gets to do her classes virtually from her bed. She never liked going to class. And for her, this is kind of a wonderful, obviously, she's heartbroken for those who are suffering. But in her the home that she's in and the place that she's in, she's very happy. I have another daughter who feels very isolated and alone. So we are all going to respond differently, but paying attention to your own inner voice and what's going on for you takes priority really over any parenting. And if you can't do that and you don't do that, it will make it really hard for you to be effective at parenting your kids. So recognize, are you more irritable than normal? Are you struggling to accomplish tasks that were easy for you in the past? And of course, the answer to all of these is probably yes for many of us, given the circumstances. Is your concentration impaired? Are you having difficulty sleeping? Are there changes in your eating habits? Okay, so I could check on a lot of these, and many parents can right now. And so the question becomes, when should I be concerned? And ultimately, how much this is impacting your ability to function is how you will know if you need to seek help. And so, you know, are you not getting out of bed? Are you having trouble getting dressed and feeding yourself, taking care of yourself in the most basic ways? This is a sort of a real sign of reaching out and getting some help for yourself first. Many of you, of course, have heard the phrase, put your oxygen mask on first. This is never more true than it is right now. To model good coping skills, really, your children need to see that you are taking care of yourself right now. And what that means for you and for each of us is going to be different. So what are your daily routines? What are you using to ground yourself right now? Is it meditation? Is it exercise? Is it, healthy eating? So really digging deep internally and figuring out what you need to do to take care of yourself should take priority, because again, you will be useless to your children if you really are struggling. And there are so many the silver lining, I think, of this is that the telehealth, teletherapy opportunities and support available right now is really quite impressive. And I think it's also very valuable. So there are a lot of great options that may continue post-COVID, a lot of mental health support. So take advantage of those if you need to. Make sure.
Lisa, I just want to interrupt you for a sec. We have a question. Is it okay to let your children know that you are struggling?
Absolutely. Absolutely. So to let your children know, to speak to your children about how you're feeling is wonderful. To exude and to be sort of, an anxious wreck in front of your children is not okay. So if in those moments when you really are an anxious wreck, and again, lots of us are struggling now, it's really important to take that privately. But talking to your kids about how hard this is for all of us is very important. Your kids are very intuitive, as you probably know. And if you don't talk about it, it will terrify them. If you're open and honest and share with them how hard this is for you, and that you will all be okay and you will all get through this, that might be a fake it till you make it if you're really not sure about that. And again, that's the time to seek some help, because most of us, as the CDC has said, will be okay. So if you're really, sort of in a state of worry for your safety, it's time to get some help so that you can really be able to parent your kids. Does that answer the question, Kathy, you think?
Okay, I have one more. What if parents' normal self-care routines aren't available?
Right. So, I mean, we all have to sort of get very creative right now. So I would say that you would have to look at your self-care routine and modify it accordingly. So if the gym is your self-care routine, obviously there are incredible online fitness programs you're going to have to tap into. I'm trying to think of what else, other than, needing to get out of your house. If your job is, and getting out of your house is your self-care, then really creating a space for yourself in your home that is your workspace that your children are not allowed in. And that's a very important thing to say. This is my workspace, and you can come in. My daughters used to say, Mom says, unless I'm bleeding from the head or vomiting, I can't interrupt her during work. Clearly there are rules, but your kids should know the boundaries of when you're working and when you're not working, and creating a space that's private and your own is really important. We're going to talk a little bit about that as we go on. So I mean, let's wait till the end. And if you throw out what your stress release is, and maybe I can help you think of ways that we can modify it at home. So let's wait till the end for that. Very important, I think, for all of us, and certainly for our kids who do have mental illness and challenges, to differentiate being and feeling anxious or depressed. I think a lot of our kids identify themselves as anxious kids or depressed kids, and they sort of wrap their heads around that identity. And I think we as adults do that as well who struggle. Anxiety and depression are a component of our personalities. They are not who we are. So they don't define us. They are a feeling that we have in a certain moment. Anxiety and irritable moments will pass. And when they do pass, it's wonderful to be able to take responsibility and acknowledge that you've had sort of a lapse in how you're coping in front of your kids. And those are important moments to just recognize you have had a lapse in judgment. They're going to happen more now than ever before. We are all under undue stress. And that makes it hard for us to stay focused, and it makes us irritable, and we are not as rational right now, and all of those things are okay. And it is important to acknowledge that to your kids and take responsibility. So one of my favorite quotes, and I know my parents that I coach love this quote, and we keep it on our phones, is setbacks are feedback, not failures. So ultimately, when you have a challenging moment, either for yourself or when your child is struggling, journal it, pay attention to it, recognize what happened, and work on it. So it is just feedback for the next time, and use it as information for how you're going to handle your next challenge. And practicing and modeling distress tolerance is so important. One of the most important things I think for all of us to recognize is that people with anxiety and depression, whether you're kids or adults, tend to want to alleviate that feeling. And ultimately, what we want to teach our kids is that that feeling exists and they don't have to be afraid of it. It feels awful, it feels uncomfortable, and it will pass. But in the moment when they're sitting with it, they need to learn to sit with it, and they have to trust that they will survive it. So sitting with it is a really important Mountain Valley mantra. It's actually their bumper sticker, and it's something we use all the time. Just learning to lean in to uncomfortable feelings and know that you can survive them. Another way of really modeling distress tolerance for yourself and for your kids is to be a bigger container. I love this idea for my own child because often she comes to me in such a heightened state of emotion. And when I ask her what she needs from me, she will say nothing. And she has taught me through her Mountain Valley experience and so much hard work on herself that what she wanted me to do was to just sit with it and to be a bigger container, to hold her discomfort and to be able to tolerate it. As you know, as parents, it is completely counterintuitive for us to not try to help our children who are in distress. But ultimately, the only way our children will heal and be their best selves and grow and launch into adulthood is to learn how to take care of themselves. So it really does go against, and I'm going to talk about this a little bit in further slides, but it goes against all of our maternal and paternal instincts to not help our children when they're suffering. And ultimately, that is the best way to support them, to be a bigger container. Kathy, any questions, or I keep going?
No, keep going, but I just love what you just said, to be a bigger container in terms of, because they have to feel some of that anxiety that they're feeling and know that they can work themselves through it. Is that what you're saying?
Absolutely.
Okay.
And that we are holding on to that discomfort, and it's okay with us. We can tolerate their feeling uncomfortable and their feeling stressed. And they don't need us to do anything but sit with them and be with them and to acknowledge that they're uncomfortable. And it's hard. And we're going to get into that a lot more in a couple of future slides. So in the moment of the COVID-19 epidemic, what's important right now for all of us? Most important for your kids is that you create structure in your home and set very realistic expectations. That's why this webinar is called Good Enough Parenting, right? So redefining parenting. You just have to be good enough right now. This will pass. And when it does, we can reimpose all of the important boundaries and rules that we have. That doesn't mean everything should go, to hell in a handbasket. But one of the ways to set structure and to keep things, to keep your child feeling in control somewhat, is to give them some autonomy in their schedule. So we're all home, we're all staring at each other's faces all day. Really wonderful if you can start your day with asking your child, tell me what you have to accomplish today, and then tell me what you want to accomplish today. Because the have-tos, obviously, as parents, you're going to have to help them do, you're going to have to support. The want-tos, you can let it go. But to know what your children's goals are for the day and to help them sort of set realistic goals for themselves, alleviates some of the battles in the middle of the day when, didn't you say that I thought you had to do this? Well, now you have a list in the morning of what I have to do and what I want to do. Allowing your child to create their daily schedule. Obviously, the school is not something they can create, but other than that, and helping them to fill in things that are important to you, but making sure that they can sort of take some ownership of those things. Setting up your home environment to support success. I think that's been out in the media and everywhere, that setting them up at in a quiet room to do their schoolwork, setting up a fun room, the place where things are fun, where the schoolwork isn't. Making your expectations clear. Sometimes better to write those down. I love the job charts and the daily planners. Again, it takes some of the battle out of the dynamic conversations that are going on during the day. It said it on the planner. We all agreed this is something you need to do. This is a big sentence: encourage valued action to support intrinsic motivation. But essentially what it means is that valued action is really digging deep, having your kids dig deep into what they care about, what's important to them right now, what they want to accomplish for themselves, where their goals are, and to allow them to motivate intrinsically. So to want to reach those goals themselves. And so encouraging them to say, listen, we're all in a weird, sort of holding pattern, but tell me some of the things that are important to you right now to get done. Whether it be for my daughter, she's very into calligraphy. It's really important that she works on this calligraphy project. And so, making time for those things is something that's important to her. Giving back, figuring out who she can help in a day. Those are important things to her. For another kid, it might be, working on their dance routine so they don't become less competitive in their dance team, or working on their lacrosse skills, or their ultimate frisbee skills, but recognizing that they're doing things that are valued to them, again, and then intrinsically they'll be motivated. Important to expect to relax the rules. What are you willing to tolerate today? This was a really important thing that my daughter's therapist said to me about 3 weeks ago, and I said to her, the screen time is killing me. Her head is in that computer all day long. And she said, it is not okay. And also, are you willing to go to battle over that? So the answer was no. Keeping the peace in our house right now is really important. This is a kid who the rug was pulled out from under her. She does not want to be home, as most of our kids don't, but this is a kid who intentionally went to boarding school to not be home. She knew her healthiest and best place was not home, period. And now she's kind of stuck with her dad and me. And so I wasn't willing to go to battle over that. So I am more flexible and aware. So what does that mean? It means acknowledging to her that I'm not a fan of this. So I'm not just saying, you know what, you do you, and I'm cool with that. I'm saying, you do you, I'm not so cool with that. And when things, return to normal, we're going to impose more rules and regulations regarding your screen time. So really important that she knows this is not a family value of ours, and recognizing I'm going to be more flexible in my family values right now. Entering into their space is really wonderful. I know a lot of people are talking about doing puzzles and watching movies and doing dress up, formal night in their house. My child wants nothing to do with any of those things. So what does she do? She plays these Tetris games that are really good for her to calm her down. And so I play them with her. We take turns on them. She's not a TikTok girl, but lots of the kids are into that. And if they're into that, get into that. And no, I don't love TikTok, and no, I don't love playing her video games, but ultimately connecting with her at her level is essential right now. and a really good way for us to bond and sort of have something that we can share that she loves. So we watch a lot of Say Yes to the Dress. I actually do enjoy that, to be honest. The screen overload thing, I just added the slide because I think it is important. Not all screen time is created equal right now. Obviously, they have no choice about online classes, their e-learning, the academics, and their homework. That's hours and hours of most of our kids' days. It is also the only way for them to socialize right now. It is also a lot of the ways that downtime is going to get taken up. There's a lot of downtime and a lot of boredom. So ideally, it's wonderful if our kids can learn how to be bored, but if we didn't start that way back when, they're not going to learn now in the time of COVID. So it is great to be able to be bored. However, now is not the time to teach your child that. So that's a lot of screen time. How do you know when the screen time is really a problem right now, given that it's, I would say, 14 hours a day the kids are on screens? Are they not coming down to dinner? Are they withdrawing from doing anything social with your family and the people that are in the house? Are they using it to avoid reality? This one also, not so bad. Reality is not great right now. So if it's a way of escaping from some of what the hardships are, some of that is okay. So how much avoiding are they doing? Are they not able to do anything else? Are they using it to alter their moods and self-medicate? Again, this is a matter of extremes. And does it get in the way of them doing their necessary tasks? Same thing we talked about for you. If you are not able to function, if your child are not able to do the things that they need to do in the day, we talked about that, what do you have to get done, then the screen time is a problem. And that may be a time to intervene.
Lisa, I have a question.
Go ahead.
And I don't know if I caught you before you answered that, but someone wanted to know what you were talking about. If the screen time maybe does become too much and they're withdrawing, avoiding reality and, daily functioning, what do you have strategies on what some people can do?
Yes, it's coming on this slide right here, so I'm going to talk about it.
Okay, great.
What you need to do is to reach out for help, okay? Because unless you and your kid have a really great relationship, parents are the last person they're going to listen to about this. So this is going to be at the bottom of the slide where it says create your home support team. So I'm going to get to that in 1 second. How to manage, so this is the difficult moments when you tell your kid to shut it down and they won't. Know your child, understand anxiety and how it impacts your kid and what it looks like, anxiety, depression, challenges. Do they exhibit their emotions physically? Lots of kids are somatic when they're anxious or depressed, right? So are they getting headaches that are real headaches, or are they, and I know this is often very hard to tease out with kids like ours. Mine, I have a really hard time with that. Are they behaviorally acting out? Do they seem to not be able to concentrate? So paying attention to how anxiety impacts your children, and knowing what their preferred coping strategies are. If you don't know those, then that's something that, over time, if you can get your kids some good teletherapy right now if they need it. You'll get a sense of what their coping strategies are, hopefully. Hopefully you've learned a little bit about how your kids cope just in living with them in a normal circumstance. But these are times to sort of reach out for help. So this is where I talk about building a support system. Something I talk about with our parents whose kids are transitioning from Mountain Valley home or from a wilderness program home. It's probably the point we sort of encourage and talk about most is building a home support team. Identifying those who can be supportive when you need them. And that can really be relatives, cousins, siblings, coaches, mentors, clergy, guidance counselors, home teams, obviously therapists. And the home team is really important. And this goes to sort of, talking, and this is another webinar I do, but creating a narrative for those kids who are coming home from treatment programs so that we all agree on what we're going to share with people. Your home team should know the full story about your child and where they were. And when they come home, they need to be people that know that you might need to pass the baton. Meaning when you are having a very difficult moment with your child, if you are not able to regulate your own emotions, which is often very common as parents, it's really important to be able to call in someone from your home team to help. and be able to pass the baton and not isolate. So how do you regulate your reactions? For those of you unfamiliar, a wise mind is a dialectical behavior therapy term. It essentially just means keeping yourself in a sort of calm and compassionate, wise, effective headspace. And so another one of my favorite terms, check in before you dig in. So where is my head at? Am I, another one I love is, am I in my red zone? Am I in my yellow zone? Am I in my green zone? Green zone is I'm feeling totally cool. I can handle my kids' stuff right now. Yellow, I'm going to try, but I might really not be as effective as I can be. I'm going to keep in mind who I can pass the baton to. And red is, I am not going to have this conversation right now because neither of us is going to do well. Be mindful of your own emotional triggers. What are you feeling when your child starts to struggle? Are you terrified? Are you embarrassed because you're the sibling, her brother and sister are there and you want to, keep the peace? Are you feeling hopeless? Here we go again. This is all starting again. Are you terrified that this is the beginning of your child failing, whatever that is defined as for you? Be aware of thought distortions, like tunnel vision, which most of which I just talked about. The idea that, it's all going to crap. This is going to be awful, catastrophizing, a very common thought distortion for your kids, but also for us as parents whose kids suffer. So, this is just going to turn her into a basket case, and we're going to have to send her back to treatment, and it's going to be awful. And that's the kind of catastrophizing we've done in the past. And sometimes I still do now. Black and white thinking is really just the idea of, there's no middle ground here. She's gonna, it's either my way or the highway, or it's only gonna work out if we can do X, Y, or Z, and not being able to recognize any of the nuances of how to handle a situation. This acronym TIP, I find very helpful, and I know most parents that I've worked with find it helpful. This is a sort of way to manage your, and it can be for your kid as well. It's a dialectical behavior therapy strategy as well, how to manage your kind of red zone. I am not regulated. I am a mess, or my kid is having a severe panic attack. And so T stands for temperature, I for intense exercise, P for paced breathing, and P for paired muscle relaxation. The T for temperature, we use this all the time. I am not kidding you. We dunk her head in ice water. She doesn't mind it. She asks for it. It's a way of lowering her heart rate, and it immediately calms her breathing. It works for her. Now, obviously, if you have health conditions, you have to be very careful about that. But if you are a healthy person, dunking your head to the cheekbones in ice water will actually calm your heart rate, calm your breathing, and it'll take you out of that red zone pretty quickly. Intense exercise, meaning if your kid is really dysregulated, I need you to do me a favor. Before we have this conversation, I want you to run up and down the stairs 4 times. I want you to do 30 jumping jacks, 10 push-ups, 20 push-ups, know your kid. Also takes you right out of your head and into that, and it's very hard to stay dysregulated with a sort of short-term intense exercise. Paced breathing, I think most people know about that. That's just, and there are so many wonderful, wonderful apps for meditation and breathing exercises, and pairing that with muscle relaxation. Again, there are so many guided meditations for muscle relaxation. If you need any information on any of those, feel free to reach out to me after this, but also wonderful ways to sort of lower yourself into your green zone. Kathy, I'm gonna keep going, okay?
Yep, I have a question.
Go ahead.
If you have a child, good kid, compliant, doing schoolwork, but insists on smoking pot, what does that tolerance look like?
Is a child over 21? You're saying child, I assume.
Close to 17 and a half.
I'm going to take that at the end. I would hope that the child is under some sort of a psych. If the child has never seen a therapist or a psychiatrist, clearly the pot is being used to self-medicate, right? And so we would love to find more effective ways to self-medicate than marijuana. A lot of adults use marijuana to self-medicate. This is a personal thing. I think there are better ways. And I think allowing your child again, if this is something that your child has been doing all along, and it's something that as family, your family values are, you're very accepting of that, and marijuana works for her, and you're cool with it, and it's legal in a lot of states, then I would not change those rules today or any time before this new normal ends. But if it's a new behavior because of the isolation and because we're all sort of in this new situation, I would get her some help and help her or him and help them to find alternative ways to medicate. And that could be medication. And let's come back to that if I didn't answer your question, but hopefully I did. So Kathy said earlier that I am trained in supportive parenting for anxious childhood emotions. There's an acronym for that. It's called SPACE. SPACE training is a program that came out of Yale, a psychologist named Eli Leibovitz. And it is a training for parents whose kids have severe anxiety. Doesn't even have to be severe anxiety that would bring them to a therapist, but who are therapy resistant or who are not buying into therapy. And it has the SPACE is a program that teaches parents a different way of parenting an anxious child. And the most recent research, which is remarkable, that was published through Yale Child Study, is that parents whose kids did not go to any therapy at all were found to be the children were found to be have the same amount of decreased symptoms as kids who went through CBT with severe anxiety. So in other words, kids who weren't treated at all, except parents were treated with SPACE, the SPACE training program, did equally as well. So what does that mean? It means that parents this is not about blame. It doesn't mean you caused it. It means that you can help your child to be well, even if your child doesn't get therapy, because a lot of anxious kids, their anxiety is affected by the parenting. So we talked earlier about the idea of sitting with your child's discomfort. And now I'm going to talk to you a little bit about support versus accommodation. Those are two very big SPACE training concepts. What's essential to your child being their best self and managing anxious moments are these two very, very important components: validation and confidence. For anyone who hasn't had a kid in therapy, validation is one of the most important things that many, many parents, myself and my husband included, really struggled with, believing and trusting that your kid is suffering. And letting them know that you see that and you hear that. So I hear how hard this is for you. I see how much you are struggling. I know that this is not something you're feeling good about. Just allowing them to hear that you get it from their perspective. That doesn't mean you get it from your perspective. It's the opposite of saying, that's ridiculous, you shouldn't be upset about this. This is an easy thing to manage. I get how hard this is for you, and this is essential, I believe that you can handle this. Confidence is something that you have to build, and often with kids like mine with severe anxiety, and many kids who've been hospitalized for, suicidal behaviors or for severe anxiety, it's very hard to have confidence that your child can do hard things, and yet you need to. It is essential for them to be well, that you say to them, I believe that you can handle this. Even if you don't, fake it till you make it. That's what I say to all my parents. And ultimately, you're going to see that your child can do this. So these are two really important components for kids when they're in a really tough time, is to say, I hear you and I believe you can handle this. Key ways to communicate with your kids that hopefully will lead to less conflict in a moment: reflective listening. So tell me how you're feeling. Tell me what you're trying to convey. And when they tell you, repeat it back to them. If I understand correctly, you're saying when we don't give you time to prepare, it's really frustrating to you. I hear that you're saying when I ask you to come down for dinner and you're in the middle of a game, that makes you really angry. Reflective listening is sort of an opportunity for your kid to say, no, that's not what I'm saying, or no, you're not hearing me. And really, very often we are misunderstanding what our kids are trying to tell us because we're all very heated. So this is also a way of sort of stepping back and checking in before you dig in by reflectively just saying, is this what you're trying to tell me? Or is this how you're feeling? Validation we talked about. Sounds like this is really hard for you. observing and reporting again. I'm noticing you're shaking. I'm noticing your face is getting super red. I'm noticing that, you know, you're withdrawing, or you seem like you got really quiet all of a sudden. So talking about body language, their tone of voice, their facial expression, rather than sort of delving in and saying, you must be furious, you're angry, labeling their feelings for them. Be curious. Can you please try to help me understand what you're feeling right now? Just had a mom text me a little while ago. Is it okay for me to say you're being such a bitch? No, that's not okay. Much more important to say, I feel like you're super angry at me right now. Can you share with me what's going on for you? Excuse my language. That's what she texted me. Encourage your child to problem solve. Giving your child ownership for solutions is so important, and helping them to activate their own insights. Ways you can do this, ask them, can you talk to me about what's going on for you, or can you talk to someone else? What do you think would help push you through the anxiety right now? What do you need from me? That's my favorite. I ask my daughter that every time she's struggling, when she comes down and she's hysterical, or she says, Mom, can you please help? Tell me what you need. Rather than assuming, do you want me to get you something? That was my old mantra. Yeah, I can help. I can get you ice cubes. Do you want me to get you ice cubes? Should I get you this? Should I do this? Do you want me to run the shower? Maybe if you took a bath, maybe if I just put your clothes on, you would go to school. Maybe if I put the toothpaste on your toothbrush, you would go to school. Now it's, what do you think you need from me to get you out the door? What would you tell a friend to do if they were in your shoes? This is a great one for kids, because they really can take a moment and reflect. And so I often will use a specific friend to make it more real for her. So I would say, what would you say to Alicia if she was struggling right now? Or if she was in your shoes? And I think our kids with anxiety tend to be very empathic. And so they are really wonderful friends, many of them, to other kids. And so that's a wonderful question. What does supportive parenting look like? It's parenting your kid in a way that will make it more likely that they will grow and mature. Sending a message to your child that you believe they are capable and strong. And this is my favorite. I didn't make this up. I got this from another parent coach. Allowing your child the opportunity to fail. It is an opportunity for your child to learn by letting them fail. So jumping in, fixing it, helping, trying to solve their problems really is going to hinder their success and getting through an anxious moment. What does accommodation look like? So accommodation is a very popular term in space training, and and this is not academic or school accommodations for kids with IEPs. It's not that kind of accommodation. This is parenting accommodation. Eli Leibovitz likes to say 100% of parents with anxious children accommodate their children, 100%. Because it's our intuition, it's our gut instinct to save our kids, to help our kids, to take away their pain. That's what we were built to do as parents. It is counterintuitive to their healing. And so it's really hard to not accommodate. So what is accommodating? It's adapting my behavior in order to reduce my daughter's anxiety. It's doing anything that makes it less likely for her to grow. I'm going to give you some examples. I have no doubt you all have your own. Going out of your way to avoid stressful situations. So we stopped making plans to do family things together because she was miserable sitting at the dinner table. So we just stopped doing that. Rescuing your child from the consequences of their choices. So if she didn't study, I sat with her and I read her book with her and helped her take notes. I often took notes for her. Ignoring or avoiding an issue your child doesn't want to discuss. That was huge for us. My daughter didn't get into boarding school, and not a boarding school, a private school she wanted to get into, and I didn't tell her for 3 weeks because I didn't know how to tell her. That was in 8th grade. Trying to control the outcome to achieve favorable results or avoid consequences. This is one of those calling all your daughter's friends to make sure they come over to wish her a happy birthday. Now, of course, everybody's doing these parades of cars going by. Organizing things for your kid to make sure they're included, calling another parent to say, can you make sure you include her in your plans? Going on birthday parties that, I thought she might be uncomfortable, so I asked the parents if I could come along. Doing something for your child they're capable of doing for themselves. That seems, clearly I got my daughter dressed every day at 14. So how to redefine success as a parent. Recognize that you are defined by your own actions as a parent, not by your child's behavior. Own your mistakes. As I said, setbacks are feedback, not failures. Important that your kids see that you failed. I texted my daughter yesterday. I said I had a really bad parenting moment, and I'm really sorry. And I think it really helped her to feel very validated in the moment, and it was true. Have compassion for yourself right now and always, and for your child. Recognize when they're suffering, it is hard to sit and be in pain for both of us. Two of my favorite quotes: the outcome of parenting isn't children, it's parents. Your actions as a parent determine only one thing: the type of parent you are. What your children become is ultimately a function of their choices and only influenced, not determined, by how you parent them. Okay, questions?
Lisa, that was really, really great. I wrote down so many things. I love the what do you need from me? I really related to that. Can I put you in the shower? Can I give you ice cubes? Can I? That definitely may have happened at my house. Um, I had a couple people who wanted us to go back um, to tolerating substance use, whether it's a high schooler or a young adult, in terms of what do you do when that is something they just will not stop?
Do you have any thoughts on that, Kath? I mean, I really believe if it is self-medicating, which it almost always is, right? If it's not just recreational, because my friends are, we're at a party and a bunch of us are doing it. It's the same thing as screen time, really. What are they using it for? If they're using it as an escape, as a way of relieving distress, ultimately, what we're really hoping we can teach our kids is to sit with discomfort, right? It is real. Life is uncomfortable. Nobody is experiencing that more than now. Everything is hard and life is hard. So sitting with uncertainty and recognizing that life is not going to give us guarantees. And we have to be able to tolerate that discomfort. So clearly, this is my slant on this. If your child can't sit with discomfort and needs to smoke pot in order to feel comfortable, then I would get them help. I think it is a problem.
Yeah, and I generally agree that it is could be masking, like you said earlier, a larger problem that needs to get looked into a little more, right? And that, starting with therapists or psychiatrists or reaching out to someone like you or me, in terms of, you know, getting down to the bottom of that, what's going on.
If by the way, and this is not for this particular question at all, I'm not suggesting this, but if anybody needs to know or wants to talk about how do you know when your kid needs residential or more intensive treatment, obviously this is what you guys do as well, but this is something that I can call me. We can talk about this because I mean, what you do is to place kids, but I can tell you when and if the time is right. And what an incredible, and I am not here to market Mountain Valley at all. Any residential treatment can be so incredibly valuable. And while it might feel like a lifetime, when you look back, my daughter's life changed. And I'm sure most kids who need to and go to a residential treatment program, she's a warrior now. Both my daughters are, but this one, I mean, she will navigate things that she never could have navigated before. And it was the whole 76 days that felt, I can't even remember it anymore. So just don't be afraid if that's the path your kid needs.
And I totally agree with that. And that's why we're doing this, because everybody, right, needs a little extra help right now. And that is what myself and Lucy and Fran, we do at Elm Street Placements, help with that placement, and working with the guidance of someone like Lisa in Mountain Valley to make those decisions. If there, Lisa, one question is, just so you know, everybody has been saying how relatable You are and informative, and they really got a lot of valuable information, which is wonderful. So thank you again for joining us. Is there any chance that the slides could be made available?
Absolutely.
That's okay.
You have the recording, right, Kath?
And I have the recording as well.
Yeah, I can send the slides.
Okay, great. Okay, well then that is it. So I want to thank Lisa Rosen again from Mountain Valley Treatment Center. And thank you all for spending your Thursday night with us. I hope you found it as informative as I did. Thanks again.
Thank you.